Me to record it also?
For like the YouTube.
Yeah, I'll go ahead and record it. Okay, you're ready.
Okay. Hello everyone, I'm Kayla Butera, the intern at Princeton Integrative Health. I'm alongside Dr. Vinny here to talk about our What If series. In particular, what if you could prevent or reverse the effects of Alzheimer's disease? So Dr. Vinny is the co-founder and medical director of Princeton Integrative Health. He has distinguished careers in emergency medicine and family medicine spanning 32 years. But despite following the advice of conventional medicine, he suffered from an episode of unstable angina, a life-threatening condition while he was out for a run. This led him on a quest with the help of his daughter Jenna that led to his discovery of functional and integrative medicine and the creation of Princeton Integrative Health in 2016. His life's mission is now to help others benefit from his challenges and what he's learned in his journey so that they don't have to suffer what too many people suffer from: premature disease, disability, and death. His goal is to help everyone have healthy longevity so that they may have an impact in the world and reach their life and legacy goals. So with that in mind, we're going to be talking about Alzheimer's today. So Dr. Vinny, I'd really like to get to know, first of all, how did you get involved in Alzheimer's? It's one of the main proponents of your focuses at Princeton Integrative Health.
Yes, thank you, Kayla. Thank you for that kind introduction. Yes, so Alzheimer's disease. The reason I got involved in that is, you had mentioned my coronary artery disease, my unstable angina. And as I was looking at prevention for that, one of the markers, one of the tests that we do is a genetic marker called ApoE. And there are three different markers three different types you could have: ApoE2, ApoE3, or ApoE4. If you're ApoE4, your genetic makeup is very inflammatory, which is great if you have to fight off infections and that kind of thing, but not so great for complex chronic diseases like coronary artery disease. So that contributed to that. And also, research has shown that if you have ApoE4, you have an elevated risk, anywhere from 30 to 50%, some people say even higher, of developing Alzheimer's disease over your lifetime. But that's only if you don't do the right things. So so it turns out, so my connection turns out that I have ApoE4/4, meaning I have 2 copies of ApoE4. So that puts me in the highest risk category. So I decided that that would make me unhappy if I got Alzheimer's disease. So I was going to find out what I could do to prevent that, and in learning how to do that, decided that these were things that we could help other people learn how to do, how to prevent Alzheimer's disease.
And we're lucky today that we have so much genetic testing that we can kind of anticipate and understand what diseases we're particularly at risk for. But at the same time, as you mentioned, genetics don't determine everything, luckily, and that there's so many environmental factors, not just with what you do externally, but internally, that can help change that trajectory that genetics seems to paint as fixed. But a little bit on the background of Alzheimer's, what's the mechanism behind it?
So before we go to the mechanism, I did want to say, you were kind of talking about the field of epigenetics there, where our genetic code is fixed, but what gets activated, what genes are expressed is not fixed at all. And we can alter that by, as you said, diet, lifestyle, all of that. So that's where the power of this kind of approach comes in. I'm sorry, ask me your question again.
Oh, I was just going to ask about the mechanisms behind Alzheimer's.
So Alzheimer's is a multifaceted disease. I think, as most people who have studied this have come to realize, there are many contributors. I mean, ultimately what happens is that neurons in the brain start dying. kind of paring back connections versus staying healthy, keeping connections, that kind of thing. And specific areas of the brain, such as the hippocampus, that's primarily where neurons are dying. And that's the hippocampus is essentially the memory areas. But there are many different contributors. I guess people who've been listening to me for a while, they'll recognize some of these. Things like inflammation can contribute. Blood sugar problems can contribute. Infections can contribute. Heart disease, vascular issues contribute. Traumatic brain injuries can contribute. So oftentimes it's, I don't remember, did I say toxins? Toxins certainly can play a big role. So it's often a combination of all these various contributing insults to the brain that result in what we call Alzheimer's. So even though two people may look exactly the same, really what's caused your Alzheimer's might be very different, and they need different inputs to help their brains function better.
Yeah, and in fact, one of the words that I feel like I often hear with Alzheimer's is amyloid plaque buildup, and that's one of the big contributors, and that certainly can contribute. But there are certain cases where people have a lot of amyloid plaque buildup, yet no symptoms of Alzheimer's. So it's interesting to see how it looks different in everybody, and different factors can contribute in different ways in different people. So it's really about the individual basis and how that transforms the disease or prevents it.
Amyloid, since you mentioned amyloid.
Yeah.
Amyloid is often a side effect of something else going on. Oftentimes it's due to trying to protect the brain from infectious organisms, and so it builds up. So there have been many attempts at using drugs to get rid of amyloid. I just saw that they have another immunotherapy that they're talking about is going to help clear amyloid. Unfortunately, amyloid, certainly can get involved in the neurofibrillary tangles and all of that, but it's usually whatever's causing the amyloid that's actually causing the problem. And just getting rid of the amyloid so far has been a spectacular failure at actually impacting Alzheimer's disease at all.
That actually brings me on to the next point, which is the new drug that the FDA had approved over the summer called Aduhelm, which has been getting a lot of attention, but both good and bad, I'd say. Can you share a little bit about what Aduhelm does and how helpful or unhelpful it is?
Yeah, Aduhelm is spectacularly expensive, over $50,000. Is that a month?
I think a year, it's 56,000 per person a year.
Okay. It hasn't really actually even been shown to really impact the cost of Alzheimer's, and it is such a high price that it doesn't really seem to me like it's worth it. You could spend that money more on impacting patients' lifestyle and their insulin sensitivity, and get much better results than they're seeing with Aduhelm. I think the reason it got approved is because so far it's been a pretty hopeless disease, and there's nothing else really out there that really treats Alzheimer's, and this doesn't really treat Alzheimer's. So I would say that again, this one is trying to Aduhelm is trying to clear the tau protein. And again, it is not really even altering the course of it. So,
I was reading that, so the FDA believes that an amyloid reduction should lead to like some meaningful clinical benefit, but at the same time, there have been past medications that work in a similar mechanism, like Pfizer's bapineuzumab, that has failed. And also apparently that the most readily detectable form of amyloid, which is the fibril, is not the worst type of amyloid. The most harmful type is called a toxic oligomer, which is actually undetectable in the living human brain. So there's definitely so much more research that needs to be done and is being done to understand what's really going on behind Alzheimer's.
Yeah. And a certain number of people also, they get brain inflammation from the drug, which is obviously not very helpful.
Yeah, it's brain inflammation is one of the contributing and driving forces of Alzheimer's, as you mentioned before.
Yeah.
And so how do you measure, though, inflammation exactly? What are you looking for in a blood test or in any testing that you prescribe?
Yeah, I mean, we are, for the purposes of what we're doing to prevent Alzheimer's, we're looking more at kind of general inflammatory markers, the C-reactive protein. Many people are familiar with that from heart disease. Many people know that if that's elevated, marker of systemic inflammation, that there's increased risk of heart disease, but not just of heart disease, of dementia, of stroke, because anytime there's elevated inflammation in the body. We also do, I do many blood tests through Cleveland Heart because they have the best inflammatory markers overall, markers that can tell about actual inflammation in the vascular wall, which is very helpful to know, and points to, particular things that you can do. Other markers that are, can tell about inflammation in the oral microbiome, periodontal disease, and sometimes even when people aren't, don't have traditional periodontal disease, can point to the fact that they might have problems in their oral microbiome that have to be addressed. So looking for, inflammatory markers, so that we can find what's causing that and help to relieve that inflammation and therefore help prevent disease.
Right, exactly. So with Aduhelm not being so much of a clinical benefit and all this testing that we have at our fingertips, really, it sounds like the name of the game is prevention. So how can we prevent Alzheimer's?
How can we prevent Alzheimer's? Well, a lot of that goes back to our foundational things that we always talk about: eating a good diet, a diet that is low in carbohydrates and sugar, that promotes insulin sensitivity, that kind of thing. That's very helpful. That usually is a diet that also is anti-inflammatory. Whether you choose a low carb keto diet or a Mediterranean diet or a plant-based whole food diet, different diets will fit different people. It doesn't all have to be the same diet. If you get into treatment for reversing cognitive decline, usually the best diet overall is a diet that tends towards keto because the brain just works better on keto. But for prevention, there are different diets that people can choose as long as they are maintaining their insulin sensitivity. Being active, that 150 minutes per week of moderate intensity activity, that walking that people do, running, pickleball, volleyball, whatever, dancing, all of those things are great. And when you do physical activity also, because you're utilizing your motor neurons, it's keeping that part of your brain healthy. Making sure you're getting adequate sleep, making sure you feel refreshed in the morning. And if you're not, getting assessed for sleep apnea. or many people on their on either their smartphones or their Aura rings, they can check and see what their overnight oxygen is, overnight oximetry, making sure that that is staying in a good range, because obviously if that is dipping, that's not good. That's definitely, then you definitely need to have a sleep apnea test. But sometimes you can have sleep apnea and disturbed sleep and not get to the point where your oxygen is dropping. So if there's any feeling of not being refreshed by your sleeping, lagging energy during the day, then I would recommend people get tested for sleep apnea, because that is a huge risk factor for heart disease, stroke, and dementia that is woefully underdiagnosed here in the United States. So it's important. And then stress management, learning how to deal with the stresses of everyday life seems like that's more important now than ever, what's been going on in the world with COVID and everything else. So, that's the foundation for everyone. And then, at around the age of 45, it's recommended to have what's called a cognoscopy, where people's specific risk factors, it's testing, it's some of it's historical testing, some of it is blood testing, some of it is cognitive testing. Specific risk factors can be identified for people, and in enough time to do something about them to actually prevent Alzheimer's disease, because it's a lot easier to prevent Alzheimer's disease than it is to treat. I mean, that is true for any disease. It's a lot easier to prevent, make the changes you need for prevention than it is for treatment. But unfortunately, many people wait until they actually need to be treated before they actually do anything about it. So, we're trying to get to people the idea that just like you have a colonoscopy, we used to say at the age of 50, I think they moved the age back to 45 now. Around the time you have your colonoscopy, you should probably have a cognoscopy, because we feel your brain is at least as important as your colon is, so it'd be, be a great idea to take care of that at least as well as to take care of your colon. So maybe that'll be our new tagline.
Yeah. No, it's incredibly important to have that preventative mindset, because hopefully at some point in your preventative journey, there won't be anything to prevent, because you've reached that state of optimal functioning and you've put in the work. And I think it's really interesting how, it always comes back to the foundations, no matter what disease we talk about or face. It's always about, your mind, stress, sleep, exercise, diet, and all of these are inextricably tied to one another. You can't just focus on one and expect the rest to be at that level, but they can each support each other at the same time. So one of the words that you said was oxygen, and that reminded me that we finally have the hyperbaric oxygen chamber in the office that we're going to work on setting up. How can hyperbaric chambers prevent cognitive decline or help brain functioning?
Sure. Yes. Yeah. We after months of getting ready for the hyperbaric chamber, it's finally here. So just briefly, what for those of you who don't know what a hyperbaric chamber is, that's a chamber where you are in the air around you is at pressures above atmospheric pressure. We have what's called a mild hyperbaric chamber, where it goes to 1.3 atmospheres, so just 0.3 above what is the regular atmospheric pressure. But even at what they consider mild hyperbarics, the pressure that is placed on the air increases the oxygen that goes not to just people's red blood cells, because everybody, a lot of people are doing they're checking their oxygen now because in this time of COVID, that's one of the things that, people are doing. And we know, people are 96%, 99%. Those are the red blood cells. They're measuring the saturation of the red blood cells. With the hyperbaric chamber, you're actually not only putting oxygen onto the red blood cells, but also into the plasma, into the fluid, which does not normally carry oxygen. So that floods your entire system, your tissues, your cells with oxygen. In terms of the brain is one of the most energy intensive organ that we have for, obvious reasons, controlling everything else. And so it has the greatest need for oxygen. And if there are areas that are not working well, the oxygen from the hyperbarics can oftentimes wake up those dormant brain cells and get things functioning better. So it's great for prevention. It's great for people who have had traumatic brain injuries where there are sometimes cells that go dormant and can't be restarted without the help of something like hyperbarics. But also for any of the diseases of aging, vascular disease, toxins, all of that, the extra oxygen helps all those conditions and helps the brain function better. So it can help both prevent, but can also be used as a treatment for somebody who has cognitive decline or stroke.
It's so exciting that we finally have it in the office and that it could be of so much service and help to people, both preventatively and as a treatment.
Yep. Yep. Thanks for bringing that up. And we will definitely be talking more about that for sure.
Definitely. With that, do you have any concluding remarks about what if we could prevent Alzheimer's disease?
Yeah. Again, I recommend people, take a look at the foundations of their health, their diet, exercise, stress management, and sleep. Look at that. And then again, take as good care of your brain as you do of your colon. Get a cognoscopy as well as a colonoscopy. And even if you're not going to get a colonoscopy, get a cognoscopy anyway, especially if there's any risk factors in your history, whether that's family history or you have diabetes or you've had traumatic brain injury, because all of those things are, if we identify those risk factors early enough, then there's something we can do about all of that to help prevent future disability.
Definitely. And for our viewers who are interested in getting a cognoscopy, where can they get that?
They would have to see somebody like Princeton Integrative Health, who has done, I've done certifications with Dr. Dale Bredesen, who wrote The End of Alzheimer's. And he's coined the term cognoscopy. You can read about that more in his book, but essentially, again, it's testing, some blood testing, some cognitive testing, and taking some history. Either us or you can find other practitioners who also do that. We don't care where you go, but we really feel that you should get somebody that can help you with that, especially if you are at increased risk. So.
Well, thank you so much, Dr. Vinny, and to our viewers for joining us this week on What If You Could Prevent or Reverse the Effects of Alzheimer's Disease. You can find us here next week with our new What If episode on what if you could create a blue zone in your community. Thank you again. Bye, everyone.
Thank you, Kayla.